Good day, everyone. We are the group B4, and our topic is hypertension. Next, please. Our group member is Miss Tilano Shalane, me, Tilano Samantha Nicole, Sir Ursulum Keith William, Miss Oy Dimple, and Miss Vasquez Trachamay. So, high blood pressure, also known as hypertension, is characterized by blood pressure that is higher than normal. Your blood pressure fluctuates throughout the day as a result of your activities. Having blood pressure readings that are consistently higher than normal may lead to a diagnosis of high blood pressure. Next, please. Your blood pressure reading has two numbers. The top number is the systolic blood pressure, which measures the pressure on the blood vessel walls when your heart beats or contracts. The bottom number is the diastolic blood pressure, which measures the pressure on your blood vessels between the beats when your heart is relaxing. For example, a blood pressure of 110/70 is within the normal range, but a blood pressure of 135/85 is stage 1 mild hypertension, and so on. Typically, blood pressure increases with age. The risk of high blood pressure begins to climb when people hit the age of 40, although it can occur in younger people. The next is causes. Mr. Keith William.
Causes. High blood pressure typically develops gradually. It can occur as a result of unhealthy lifestyle choices, such as a lack of regular physical activity. Diabetes and obesity are two health conditions that can increase the risk of developing high blood pressure. Causes. Eating too much salty foods and fatty foods and does not eat healthy foods. Over time, excessive salt intake can lead to high blood pressure, which stiffens and narrows the blood vessels. Blood and oxygen flow to key organ decreases, so the heart tries harder to pump blood throughout the body, which further increases blood pressure. Lack of physical activity. Not exercising can cause weight gain. Increased weight raises the risk of high blood pressure. People who are inactive also tend to have higher heart rates. Drinking too much alcohol. Drinking a lot of alcohol can affect the muscles in your blood vessels. This can cause them to become narrower. The more alcohol you drink, the higher the risk of developing hypertension. If you drink regularly, you are at risk, especially if you're over the age of 35. Lack of sleep. Insomnia is linked to high blood pressure and heart disease. Over time, poor sleep can also lead to unhealthy habits that can hurt your heart, including higher stress levels, less motivation to be physically active, and unhealthy food choices. For better sleep, get enough natural light, especially earlier in the day. Smoking. The effects of cigarette smoking on blood pressure are complex, with evidence that smoking increases blood pressure acutely and increases the risk of renovascular, malignant, and mass hypertension. Old age. Your body's network of blood vessels, known as the vascular system, changes with age. Arteries get stiffer, causing blood pressure to go up. This can be true even for people who have heart healthy habits and feel just fine. Next is the symptoms. I'm going to hand this over to Ms. Chalene for the symptoms.
Thank you, Mr. Kit. So, I will be discussing the symptoms of hypertension. So, hypertension is called the silent killer. Most people with hypertension are unaware of the problem because it may have no warning signs or symptoms. For this reason, it is essential that blood pressure is measured regularly. When symptoms do occur, they can include early morning headaches, nosebleed, and irregular heart rhythms. Next, please. Visual changes and buzzing in the ears. These are the common symptoms. Then, these are the symptoms of severe hypertension that everyone should look out for. The first one is vomiting, chest pain, anxiety, confusion, muscle tremor, and difficulty in breathing. The only way to detect hypertension is to have a health professional measure blood pressure. Having blood pressure measured is quick and painless, although individuals can measure their blood pressure using automated device. An evaluation by a health professional is important for assessment of risk associated condition. So that will be all for the symptoms of hypertension. Now I will give the table to Miss Dimple for the presentation of prevention for hypertension.
How can we prevent hypertension? Number one, eating a healthy diet. To help manage your blood pressure, you should limit the amount of sodium or salt that you eat and increase the amount of potassium in your diet. It is also important to eat foods that are lower in fat as well as plenty of fruits and vegetables. Number two, getting regular exercise. Exercise can help you maintain a healthy weight and lower your blood pressure. You should try to get moderate intensity aerobic exercise at least 2.5 hours per week. Number three, being at a healthy weight. Being overweight or having obesity increases your risk for high blood pressure. Maintaining a healthy weight can help you control high blood pressure and reduce your risk for other health problems. Number four, limiting alcohol. Drinking too much alcohol can raise your blood pressure. It also adds extra calories, which may cause weight gain. Number five, avoiding smoking. Cigarette smoking raises your blood pressure and puts you at higher risk for heart attack and stroke. Number six, managing stress. Learning how to relax and manage stress can improve your emotional and physical health and lower high blood pressure. Management techniques include exercising, listening to music, focusing on something calm or peacefully, and meditating. Next, Texia May Vasquez will discussing the treatment of hypertension.
Treatment for hypertension. Simple lifestyle changes can help reduce high blood pressure, although some people may need to take medicines as well. Everyone with high blood pressure is advised to make healthy lifestyle changes. Whether medicine is also recommended depends on your blood pressure reading and your risk of developing problems such as heart attacks or stroke. Your doctor will carry out some blood and urine and ask questions about your health to determine your risk of other problems. If your blood pressure is consistently above 140 over 90 mmHg or 135 over 85 mmHg at home, but your risk of other problem is low, you'll be advised to make some changes to your lifestyle. If your blood pressure is consistently above 140 over 90 mmHg or 135 over 85 mmHg at home and your risk of other problem is high, you'll be offered medicine to lower your blood pressure in addition to lifestyle changes. If your blood pressure is consistently above 160 over 100 mmHg, you'll be offered medicine to lower your blood pressure in addition to lifestyle changes. Lifestyle changes. Here are some changes you could make to your lifestyle to reduce high blood pressure. Some of these will lower your blood pressure in a matter of weeks, while others may take longer. Number one is cut your salt intake to less than 6 grams or zero point 0.2 ounce a day, which is about a teaspoonful. Number two is eat a low fat, balanced diet, including plenty of fresh fruit and vegetables. 3. Be active. 4. Cut down on alcohol. Get tips on cutting down, including downloading a drinks diary and keeping track of your drinking. Number 5 is lost weight. Find out what your ideal weight in using the BMI healthy weight calculator and read advice about losing weight if you are overweight. 6 is drink less caffeine found in coffee, tea, and cola. And the last one is stop smoking. You can take these steps today regardless of whether or not you are taking blood pressure or medicines. In fact, by making these changes early on you may be able to avoid needing medicine. Several types of medicine can be used to help control high blood pressure. Many people need to take a combination of different medicine. If you are under 55 years old, you'll usually be offered an ACE inhibitor or an angiotensin 2 receptor blocker or ARB. If you are age 55 or older, or you are any age and of African or Caribbean origin, you'll usually be offered a calcium channel blocker. ACE inhibitors. ACE inhibitors is angiotensin converting enzyme or ACE reduces blood pressure by relaxing your blood vessels. Common examples are enalapril, lisinopril, perindopril, and ramipril. The, the most common side effect is a persistent dry cough. Other possible side effects include headache, dizziness, and a rash. Angiotensin 2 receptors blocker or ARBS work in a similar ways to ACE inhibitors. They are often recommended if ACE inhibitors cause troublesome side effects. Common examples are candesartan, irbesartan, losartan, valsartan, and olmesartan. Possible side effects include dizziness, headache, and cold or flu-like symptoms. 3 is calcium channel blockers reduces blood pressure by widening your blood vessels. Common examples are amlodipine, felodipine, and nifedipine. Other medicines such as diltiazem and verapamil are also available. Possible side effects include headaches, swollen ankles, and constipation. Drinking grapefruit juice while taking some calcium channel blockers can increase your risk of side effects. Number 4 is diuretics, sometimes known as water pills. Diuretics works by flushing excess water and salt from the body through your pee. They are often used if calcium channel blockers cause troublesome side effects. Common examples are indapamide and bendroflumetazide. Possible effects possible side effects including the dizziness, when standing up, increased thirst, needing to go to the toilet frequently, and a rash. You might also get low potassium and low sodium after long-term use. And the last one is beta blockers. Beta blockers can reduce blood pressure by making your heart beat more slower with less force. They used to be a popular treatment for high blood pressure, but now tend to be used only when other treatments have not worked. This is because beta blockers are considered less effective than other blood pressure medicines. Common examples are atenolol and bisoprolol. Possible side effects include dizziness, headache, tiredness, and cold hand and feet. So that is the reporting of Group B4. Okay na.
Eh, bang sa on kita.
Ah,
Isend mo lang isa.
sige. Stop na ko recording.
Tanon mo kami hara. Copy.
Ano?
Mga 1K.
Pagkas.
Ni.